Hi, I'm Dr. Celia Dyer. I'm a general dentist in Atlanta, Georgia, and I'm here to talk with you today about teeth whitening. It's one of the most popular services that everyone enjoys having their dentist perform is the professional whitening of their teeth. And over time, most of us as we get older, the enamel thins on our teeth, we pick up a lot of stain through the years, and the color just darkens. Also, with just the popularity of teeth whitening procedures over the last decade or two, now everyone's teeth seem to be whiter, and even just sort of naturally light teeth don't look white enough. And so dental whitening is one of the inexpensive, easy ways you can really improve your smile. It's fine for someone of any age to do. I say usually a teenager, I would get parental permission, but even older senior adults benefit greatly from teeth whitening. You need to see a general dentist before you whiten your teeth because you need to make sure that you don't have restorations on the front of your mouth that if the rest of the teeth are whitened would no longer match and would need to be replaced. So while there are a lot of over-the-counter teeth whitening products that do lighten and eventually lighten, they take longer, it's still better to have a dentist examine your teeth to make sure you don't have maybe a white filling in the front or something that suddenly would not match and might need to be replaced, and you'd need to be anticipating that. There are different ways you can whiten your teeth, from the over-the-counter strips you can buy at a drugstore, and those do work. They just tend to work a little bit more slowly than a dentist's prescription strength bleach. You can go to your dentist and have the traditional whitening trays made, and that's where they make a mold of your teeth and make little plastic, very thin trays into which you spread some dental prescription bleach, and you sleep in those every night, and those do a good job, and you can use that from 2 weeks to 4 weeks, and then you can lighten them up, touch them up as needed. To tell you the truth, most of my patients were not all that compliant with the at-home whitening, and particularly the men did not seem to want to keep whitening their teeth with trays, and they would come back and they would say, well, I whitened my teeth a few nights and now they're no longer white. So in my personal experience as a dentist, the chairside in-office teeth whitening is just usually the quickest. The price is about the same as doing it at home with trays, and patients just like it because they come in and in about an hour they go out with whiter teeth. So the way that works is usually the dentist's assistant will put a material over the gum tissue that's a plastic, liquid plastic that with a little light shined on it just kind of melts onto the gum tissue to protect it from any damage by just the bleaching. If it does touch the gums, it doesn't damage anything permanently, but most people just like to protect the gum tissue. And then a bleach solution is applied all over the teeth by the dentist. And so a heavy solution of a thick material with a prescription strength bleach is applied over upper, lower teeth, any of the natural teeth, and sometimes a light is used to activate that and make the chemical reaction occur a little bit more quickly. It's not essential though. You can just lie back, listen to your MP3 player, and your teeth will be whitened usually in about 20, 30, 40 minutes. And the one thing to know is, first of all, the best time to have your teeth whitened is right after you've had a professional cleaning, because the teeth are more porous, they're not covered in anything, any sort of calculus or any kind of material that prevents the bleach from penetrating into the teeth. So that's the best time to do it, is within a few days or a week or two after having your teeth professionally cleaned by a hygienist. And it's also important to know for 24, 48 hours after you've whitened your teeth, they will still be fairly porous, and you do not want to eat anything that is non-white or beige. So you want to eat mashed potatoes, drink white wine, have chicken, but don't eat red meat, don't drink red wine, don't drink tea, don't drink coffee, and don't eat spinach unless you want your teeth to be green. So a lot of patients don't remember that, and that's really important. Another thing to know is that it's like coloring your hair. Once you whiten your teeth, you need to periodically touch them up. Usually a couple of times a year is adequate, or even just twice a year after you have your teeth cleaned. Then you need to sleep in your touch-up trays or go back to your dentist for usually a 20-minute touch-up, and there you go, your teeth are white again. So you want yellow teeth? You want nice, bright, white teeth that makes everybody look younger and healthier. And studies have shown, university clinical trials have shown there's no damage to teeth from bleaching them. Sometimes there is sensitivity, and sometimes it can be severe, but it's usually very temporary. So call your dentist. If you don't have a dentist, you need to go to appointmentcity.com and click on Find a Dentist so you can meet with a dentist and evaluate your smile and see if you're a good candidate for teeth whitening. I'm Dr. Celia Dyer, and that's your appointmentcity.com dental tip of the day. Thanks.